Sometimes you just can't fix back pain with stretching and strengthening. Sometimes there's a problem that's underlying all of that, and it could have something to do with your kidneys. I know there's a couple of them, normally for most people, that are just right back there, and they do a lot of good things in filtering out toxins within your body. But if they are a little bit on the fritz, they could be acting up in different ways, kind of like creating some back pain. So if your back hurts, okay, and you can't quite figure it out, maybe it's because you're not bending with your knees. Maybe it's because you have an undue amount of excess mass on the front of you. If you got that old spare tire kicking around and you're doing everything literally correct, but you can't quite figure out why your back hurts, okay? Maybe the old kidneys are acting up. So, Dr. David Gu, the director of Haofang Diabetes and Hemodialysis Clinic, often receives patients who come in to relieve their renal pain. The renal is kidney, okay? That's the clinical terminology for it, okay? Just to keep up. However, after examination, the vast majority of these patients have lower back pain caused by other factors such as muscle strain. Yeah, more often than not, right? This is the classic example of hearing hooves and immediately thinking it's a zebra or an antelope, okay? More often than not, it's something you can easily fix by strengthening, stretching, and losing a little bit of weight. But there are other problems as well, okay? Kidneys are silent organs, he says. Many kidney diseases do not result in lower back pain, but may show other symptoms. More common issues is kidney stones and may lead to lower back pain, though. Okay. It is often difficult to distinguish between lower back pain caused by kidney-related diseases and that caused by muscles or nerves in general. How can we differentiate from them? Well, let's take a look. 3 different ways. Let's take a look. According to Dr. Gu, that's a great doctor name, okay? When a patient suffers from lower back pain, he diagnoses the cause by its location, nature, duration of an episode, and the triggering and the relieving factors. Isn't that 4? Anyways, the pain will not be relieved with a change of posture. When lower back pain occurs, does it get better when you change posture? When you're sitting down, is it better? When you're standing up, is it better? When you lean back, Fat Joe style. Are you feeling better? Who knows? If so, the pain may be caused by muscle injury or tissue damage. For instance, lower back pain caused by muscle strain is often due to improper posture and or force. Sometimes the pain can be reduced by avoiding improper posture or adjusting the way you use force. Yes, lifting properly. However, lower back pain caused by kidney inflammation is persistent and even has sharp cramps that cannot be relieved by adjusting posture. The symptoms of lower back pain may vary because one cause or another, and to carefully examine the patient's medical history is necessary to provide a proper treatment. How about severe back pain when tapping on the lower back? If it's red or inflamed. Interesting. Okay. In case of back pain caused by kidney inflammation, tapping on the lumbar area will give severe pain. Okay. Patients get an electric shock because of vibration in the inflamed kidney area. And number 3, the pain is acute and severe. Okay. Lower back pain can be classified as chronic or acute. Chronic pain, such as that caused by muscle strain, is usually recurring as it comes and goes, while low back pain caused by kidney inflammation is often acute and excruciating, so it's going to be hanging around for a minute. Since it hurts so much, patients usually go directly to the hospital for emergency care. So if it's at that point, then you might have a kidney problem and not just a strained lower back problem. So acute kidney-related low back pain has 3 major causes: urinary tract stones, so kidney stones, okay? People often visit the doctor because they are worried about back pain caused by kidney problems. When a stone causes a blockage in the urinary tract, it prevents urine from flowing downstream. Kidneys continue to produce urine, causing the upstream area of the urinary tract to swell and causing cramps due to spasms of the smooth muscle in the Utera? Yeah. In the P area. The pain caused by the stone obstruction is often severe and unsettling. Yeah, I pray that I never have to deal with kidney stones because it sounds terrible. About a blocked blood vessel. Acute obstruction of blood vessels in the kidney caused by blood clots can also lead back to pain and hematuria. Aneurysms can also block blood vessels and be usually associated with high blood pressure. In addition, malignant tumas nadatuma may invade blood vessels or a urinary tract caused by an obstruction as they grow larger. If a tumor bleeds, if it bleeds, you kill it. It may cause hematuria or blockage of the urinary tract and cause pain. Or, yes, a bacterial infection. All of these you can't diagnose at home. You don't know if you got kidney stones. You don't know if there's not proper blood flow to your kidneys as well. And then, on top of that, how can you possibly tell from the outside looking in if you got a bacterial infection? Pretty simple. So, 4 signs of a kidney infection. All right, so the kidneys are important organs in the human body, so back pain does make people feel uneasy. So is there something wrong with your kidneys? How can you spot the problem before you get it diagnosed? So at least you have an informed idea as to what's wrong with you, so you don't quite be, that's proper grammar. Maybe that'll be the next video. No, you aren't clutching your lower back, walking into the doctor's office thinking that, I strained my back, when in actuality, you might have a kidney problem, okay? So in addition to back pain, there are 4 symptoms of chronic kidney disease that you should pay attention to seek medical attention if they occur. All right, so this one is interesting. When I was doing a little bit of pre-screening for this video, I had to, kind of figure out exactly what they meant by this. The appearance of bubble urine or hematuria. Okay, so if you got blood in your urine, obviously that's always been a classic sign. But bubble urine. So if it kind of looks like you're pouring a fizzy drink into the toilet bowl on top of that, on top of a little bit of a red hue. So if it looks like you're pouring Hawaiian punch into the bowl, you might have a problem. A sudden decrease in urine volume. If it feels like you have to go and then you go and it's just a little bit of a trickle. Okay, if it looks like you're just trying to pour out a 1/16 hose, you might have a problem. Combination of the above with high blood pressure. Again, you can assess your own blood pressure at home if you have one of those little goofy gimmicks. If recently a pharmacy in your near location, you bought the little blood pressure cuff where you just sit down, press the button, and it tells you. You can do that at home, or there's also other conventional means, things that you can buy on Amazon as well. Or you could just go to the doctor and get your blood pressure taken. Or go down to a pharmacy and just pop your arm in there and then press the button, as long as they have the proper cuff that's on there. Because there are, in fact, different cuffs for larger or smaller sized arms, okay? I learned how to manually take blood pressure, much to the behest of my previous instructor on that topic. I hate her, and I hope that she's well off in retirement right now. I'll just go ahead and say that. And then, yes, on top of that, just the general diagnosis of fatigue. If you're feeling a little slow, don't immediately assume that your kidneys are on the futs. According to Dr. Gu, these symptoms are mainly due to kidney damage, to a certain extent, resulting in the organ's inability to excrete waste products from the body. Yes, exactly. So, that was the descriptive. What about being prescriptive? Okay, how do you keep the kidneys on the up and up? Take good care of the kidneys. Best to start at the source, such as controlling the blood pressure, blood sugar, and blood cholesterol levels. Yes, imagine that. Exercise, eat healthy, and stay adequately hydrated. I know it's a magic prescription, but it often works. With all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.